Well, with a concussion, we think that it's rotatory or rotational acceleration of the brain within the skull that produces the concussion effect. So if my hand is the brain and this hand is the skull, it's movement of the brain within the skull that produces concussion. And we think it's rotational movement, or like a jiggle of the brain, rather than linear acceleration. But the exact explanation for what goes on in the brain is unknown.
If the player is conscious or returns to consciousness within seconds, then you can start an assessment. And a lot of that has to do with asking questions initially. You as a trainer, you want to reassure them first and foremost that they're going to be okay. Then you need to assess where they're at. And that just takes a few questions, asking them if they know where they are, asking them if they know the score, where does it hurt, a number of simple questions like that, and just establish their level of consciousness. Assuming that this player is complaining of head issues only, and there's nothing neck or back, you can determine that it is safe to move them. And the sooner you can get them off the playing field, the better, because we do consider most playing fields as kind of I guess you call it a dangerous atmosphere.
Certainly speaking about concussion specifically and or brain injury, I think any penetrating trauma, certainly that's concerning. Any seizure activity, a prolonged loss of consciousness, potentially up to a minute. I think any deterioration of status at any point after the injury certainly is an indication to have someone seen. I think that repetitive vomiting certainly is a concern. And I think that any evidence of C-spine injury, as I said, any coexisting injury that's concerning obviously is concern. Beyond that, I think that if you recognize that there's any transient paralysis at any time and or complaints of numbness, what have you, in the limbs, that would also be an indication to be seen.
A player who comes to me in the middle of a game or a practice and says that they're not feeling right, and says that they don't feel like they can continue, there needs to be a removal from play so there can be an assessment happen. A lot of it is asking questions and listening to them, but also watching how they respond. And it always comes down to, if in doubt, keep them out.
There are 4 minimal criteria for return to play. An individual has to be asymptomatic at rest, asymptomatic with exertion. They have to have a normal clinical evaluation by a healthcare provider, and beyond that then return to normal baseline testing on computer-based or neuropsychological testing.
First of all, we can prevent these injuries. Okay? We need to make sure that our athletes are capable of doing the skills so that they have the physical and the mental or cognitive ability to do it. So that they need to be physically fit, what we call physically literate, so that they know how to move, but they also understand what it is they're doing and why they're doing it. And if you put all those pieces together, they're going to be able to make smart decisions, and smart decisions are going to help keep them safe.
There needs to be a great level of trust between the coach and the trainer. And the trainer has to be allowed to be the trainer, and the trainer needs to be a trainer, not an assistant coach. And that trainer needs to be in charge of the health of the players at all times, and the coach needs to respect that the trainer is doing the best that they can with their level of knowledge and training, and that they're going to make an assessment on a player regardless where they're hurt in their body, of whether it's safe for that player to continue or not continue.
What is the case now is, in terms of head injuries, if you go back and you play too soon, you're much more likely to have a recurrence, and a more serious recurrence of it. And the best thing for you now is that 5 years ago, none of your teammates would have understood the problem of a concussion and why you're not playing. They'd look at you and say, "You look fine. You're not limping. Why are you not playing?" Now, many more of your teammates know because of what they've seen on television about the consequences of head injuries. Many more parents know, many more coaches know. It's much more possible for you now to get your story across that in fact you just don't feel right at all. You don't know what it is, but you don't feel right. Well, that's the message that you need to deliver.
You know what, your brain is made of gray matter, and the gray matters. So let's take care of it, let's be educated, and let's make sure that we do all we can to keep our athletes' brains healthy.